Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Anthony Porto. Hello, Anthony.
Hi, Jess. How are you today?
All right. So today we are going to talk about fatty liver. The clock is ticking, so let's get to it. So, Anthony, I think this topic might surprise some parents. Fatty liver disease in children and teens. So let's start with the basics. Fatty liver disease was once considered an adult condition, but it's now more prevalent in children and teens. So what exactly is fatty liver disease?
Fatty liver disease is actually known as what's called non-alcoholic fatty liver disease. So it's basically changes in your liver that occur because a certain type of fat called a triglyceride builds up in the liver. And over time, it can lead to inflammation and potential liver damage.
Okay, so are there certain kids who are at higher risk of developing fatty liver disease?
So yes, there are certain kids who are at higher risk. The reason why we're seeing fatty liver more often in children is because of the obesity epidemic. So those who have a body mass index above the 85th percentile, which means they're overweight, or above the 95th percentile, which means they're obese, are at higher risk. This is also true for kids who have what's called central obesity, so where there's an accumulation of fat around the belly, those with insulin resistance, type 2 diabetes, and those who have abnormal liver tests and lipid panels, and who may have sleep apnea or a family history of fatty liver. It's actually more common in kids who are Asian American or Hispanics.
So what are some of the signs and symptoms that parents should be aware of when it comes to fatty liver disease in children?
So most children won't actually have any symptoms. So if they are at high risk, it's probably important for them to speak to their pediatrician to see if they should be evaluated for fatty liver. Sometimes kids may complain of right upper belly pain, and that's sort of where your liver is, and that may be something that may be an indicator, but usually diagnosis happens after you do some blood work.
Okay, so if a parent suspects fatty liver disease, what kinds of tests can help in the diagnosis?
So sometimes your pediatrician would start with blood work. They will look specifically at a liver function test where they will see if your liver enzymes are elevated, and then they may try to look with some radiology studies. So sometimes an ultrasound can show that there's extra fat around the liver, and sometimes an MRI. If there is suspicion, they may refer you to a pediatric gastroenterologist who may recommend a liver biopsy. And that's where they take a piece of the liver tissue and look under a microscope to see if there's any inflammation or liver damage.
All right. So let's say a child is diagnosed with fatty liver disease. How would it be treated?
The major treatment right now are lifestyle changes. And that means reducing processed sugars, fat in the diet, and also increasing exercise. Weight loss and vitamin supplementation may also be needed, and it really depends on the child. These changes in diet can really have significantly benefits to kids with fatty liver disease. So they may really help to decrease that inflammation and decrease any progression to liver damage.
All right. So what are the potential consequences if fatty liver disease goes untreated?
So the timeline is really not definitive. What happens is as fat accumulates in the liver, it can lead to liver inflammation and scarring. And then once the liver scars, it could eventually lead to liver failure. Fatty liver is right now the most common reason for liver transplants in adults. So it's really important to detect this early and manage and treat this early on.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your bite of health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.